I now request Dr. Anupam SAHU, who will be speaking on instrument cleaning and sterilization, a area where a lot of us have lot of confusions and lots of issues. Can the timer be reset to 15 minutes?
Good morning, everybody, and thank you for coming so early in the morning. I'm Dr. Anupam Sahu, and also thank you to APO AIOS and to Dr. Samrat Chatterjee for giving me this opportunity to talk. So I'll be talking about disinfection and sterilization. So basically it includes both the instruments and our operation theater also. I have no financial interests. So basically we have built a very good hospital now, and we all know that it won't stand the test of time if we don't maintain it very well, and that maintenance needs to be followed according to certain protocols. These protocols have been set over a period of time, and as of now it's a very set protocol. Before that, we need to know the definitions. Cleaning basically is just the removal of visible soil from objects and surfaces, and normally is accomplished manually or mechanically using water with detergents or enzymatic products. Disinfection is the process of elimination of many or all pathogenic or microorganisms, but except bacterial spores. And sterilization describes the process that destroys or eliminates all forms of microbial life. So we all know that for us in ophthalmology, it is only sterilization that is needed, unlike for some other specialties. So coming to the operation theater, as we have Dr. Deepshika Agrawal has already discussed about these zones. So these zones are very important, not only for building the hospital but also for maintaining them. So we already know about these zones, but then each zone, for example our sterile zone, it needs the strictest protocols amongst all. So disinfection, sterilized instruments and frequent cleaning. So anything that goes into the sterile zone should be as sterile as possible, including us. So then we come to the clean zone. The clean zone basically needs disinfection and cleaning. That is more than sufficient with a regular maybe fogging or deep cleaning on a weekly basis. Outer zone cleaning is sufficient. Outer zone we saw was the reception area and all. They also need to be cleaned properly so that no dust or mud or all those things come up to the clean zone. And then we have the disposal zone where we have biomedical waste management systems and instruments that need to be cleaned out there. So in the OT, daily cleaning is important. This daily cleaning again should start from the innermost to the outermost zone. So from the sterile zone to the clean areas, and it should start from the operating room, the scrub area, the pre-op areas for inside the OT complex, and then outside there's a separate team that does the cleaning. And inside the operation theater also it should be from inside out. So you start with the OT table, instruments and then surfaces. Example, you have different options: glutaraldehyde, hydrogen peroxide, sodium hypochlorite based. For example, we use bacillocid extra. Floor should be cleaned the last, because by that time things would have fallen onto the floor, and that should be the last to be cleaned. Wet mopping followed by mopping with quaternary ammonium compound based bacillocid floor or D125, or even 0.5% chlorine is good enough for this. UV light is switched on when the last person, UV light is again very important, it maintains the sterilization. It should be switched on when the last person leaves the OT and is switched off before the first person enters the OT, so that it doesn't cause any damage to us, and it maintains a aseptic environment in between. Weekly deep cleaning should be done on the weekends specifically, so that Sunday is there for the OT to relax as such. So cleaning of the ceiling as well as the wall mounted items, that should be done on a weekly basis. All the articles that are removed from the shelves and cleaned. So ideally as little material should be there in the OT as Dr. Deepshika has advised, but then whatever is there, for example your equipments, microscopes, beds, everything should be deep cleaned during this period, again with the quaternary ammonium compounds. HEPA filters of ACs are to be removed and cleaned with detergent solution, and they should be dried well before fixing well, because we should remember that any amount of water or humidity will predispose to any infections. Now fumigation as of now is not routinely recommended, but you can go ahead and do it. It's on a weekly basis. If you do it, it's not that much of an issue, and fogging and all is not very costly with formalin and all. But then we also use D125 and other instruments which may be costlier, but then it depends on your own setup. As of now, most of the cleaning is focused on the deep cleaning that we do. But for some circumstances, like after our construction or some renovation, after some major civil or maintenance work, or while commissioning new OT, or reporting of any infection in OT or culture report. So whenever Dr. Samrat will be telling us about the culture and all, so if you get something positive in that, then we again need to do a fumigation for that OT and then get reports on that. So these are the different options that we have: Bacillocid, Resent, Virkon. These are costly. Formalin, hydrogen peroxide, combination of silver nitrates, they are cheaper than that. So as I said, now stress is more laid on cleaning of OT floor with antiseptic solution or disinfectants, but even doing this won't be harmful to us. Coming to the instruments. Now, instruments are something that go into the eye, and that is where we are more concerned about endophthalmitis. So, and also TAS, because one is infection because of external organisms, one is the infection that inflammation that we cause to the eye. And for that, we need to ensure that our cleaning processes and sterilization processes are good enough. That is, one of the major causes of toxic anterior segment syndrome is when residues are left behind. So we need to ensure that our cleaning system is very, very proper. So other things are also there, the fluid that you are using and all. But what is in our hand is we need to ensure that our cleaning and sterilization process is perfect, so that there is no remnant residue on the instruments. So these are the steps basically that we should be doing for instruments. Inspection, you should see whether there is any blood clot or anything. Cleaning, drying, storage, packaging, sterilization and documentation. I'll come to them. So after surgery, each instrument from the set should be carefully scrutinized for defects, debris, anything, or as the doctor would have suggested at that time. Do not allow, so this is very important for the staff, that you should not allow any tissues, blood irrigating solution, viscoelastic medicines. Viscoelastics also stick, and then it's very difficult to remove them once they are dried. And especially in cannulated equipments, if that cannula gets stuck with visco, you cannot remove it then. So they should be cleaned immediately at the end of the surgery. So this is how the instruments are being cleaned. The blades are cleaned and cannulated instruments should be flushed. For example, your phaco probes and all, they should be immediately flushed immediately. And these instruments and then washed under running water. So they are taken out from the waste corridor and they are then cleaned in the CSST. And later on, the cleaning by 4-bowl technique or ultrasonic cleaner. Okay, so this is the cleaning that is being done in CSST, followed by the 4-bowl technique, or you can also use. So this is basically the most important thing, the 4-bowl technique. So instruments are double dipped in chlorhexidine and cetrimide solution, 2 trays for cleaning and then distilled water, 2 trays for rinsing, so that no residue remains. Tray 1, 5 minutes, that removes the major debris, but then whatever is remaining after that, that will be disinfected with the tray 2. Then you go to the tray 3 where you keep it for 10 minutes and then tray 4 again 10 minutes. So at each level we are processing the instruments. So first 2 are for disinfection and the next 2 are for the cleaning process. Instruments are then placed in chlorhexidine and cetrimide solution in tray 1 and 2, and thorough cleaning is done with the help of a toothbrush. So for serrated instruments and all, we need to clean them with a fine soft, super soft or soft toothbrush, so that debris can be removed without any damage. So the serrations and the joints and locks are very important places to be cleaned, because otherwise they get stuck, and those are the places where the debris again leads to earlier damage to the instruments also, and because these are the places where the corrosion will also start. Enzymatic cleaners as of now are not preferred for ophthalmology, but then for some conditions like oculoplasty or where there is significant bleeding, in those cases we can use rapid multi-enzyme cleaners by 3M, which is 10 ml of the enzyme in 990 ml of distilled water. It's placed in the solution for 8 to 9 minutes, and then it's again important to rinse and dry the instruments well, because these again can lead to, so that's why they are not preferred nowadays, because incidence of TAS may increase with these cleaners. They are very strong. Ultrasonic cleaner again not very preferred, but then for again cases where you have lots of bleeding and all, where you can use them. but then they can damage the instrument also. Make sure that the instruments do not touch each other when they are kept in the basket, so that they are not damaged too much. Now coming to the drying part, which as I said is very important, because humidity will lead to immediate onset of growth of organisms. The instrument should be dried by aeration or hot air. This is very important, so that no humidity remains on the instruments before it goes for sterilization. It should not be wiped with a cloth or something, because that will again lead to removal of the surface coating and blunting of the instruments. Storage, surgical instruments are usually stored as a set, we know that. So each cataract set and instruments belonging to one should be kept in their respective trays only. That should be something your staff should follow. Trays and instruments can be marked in similar codes so that they are not interchanged, and pointed tips and blades and scissors should be kept in the plastic sleeve, as we can. So your silicone or plastic sleeve can be used. For moving parts, we can use lubrication again before it goes for sterilization, only when you feel that there is significant limitation of movement of your instrument. So surgical grade silicone or Teflon spray should be used, but not normal lubricating oils, because those oils will remain on the surface. Again, packaging for sterilization is very important, because if we don't do a proper packaging, there can be immediate reinfection in the our sets. So all instruments need to be packed before sterilization, and this is the double packing method for steam autoclave, where we use double packs. The first pack is the one that becomes contaminated, and then the second one is given to the assisting nurse to open up on the sterilized area of the OT. Okay, and in the OT also you should have a sterilized area at the head part of the OT table. So that's the part where nothing even clean or not very dirty thing should be remaining for long. And for ethylene oxide also, we have ethylene oxide gas sterilizer, and on that we can use the bandages, iPads and all, and again instruments, if you are trying to reuse them, they can be used, but then it should be cleaned properly. And packing should vary as per the specification of the instrument maker. Coming to disinfection and sterilization, we already know that for us sterilization is the most important part, because we come in contact with sterile tissues and blood systems. Disinfection is not recommended as of now. Sterilization, different types. Sterilization under pressure, that is autoclave. There are different types of autoclaves now available. It is dependable, non-toxic, inexpensive and sporicidal if done properly, and can penetrate fabrics well. Dry heat or hot air oven, it's done for articles that can be damaged by steam, sharps, oils, ointments, etc. And ethylene oxide, it provides low temperature sterilization for heat sensitive, for example, iPads and all them you can do on ethylene oxide. So there are different modes. Basically now we have lot more machines which have lots of varieties. They have 2 modes, 4 modes and all. But then basically if you are doing it at 15 psi pressure, then temperature usually goes should be at 121 degrees centigrade, and time should be around 30. If you are going to do it for fast, then 30 psi, 134 degrees centigrade, and for 4 minutes. And it's also important to remember that you should use them for ideally 48 hours and not later, because then the sterilization may be compromised. This is the whole cycle of a steam autoclave, and this is the ethylene trioxide gas sterilizer, and these are the things that can be sterilized with it. This is the EO gas sterilizer that is placed in it along with a this is the dosimeter that identifies whether the sterilization has been done properly. It's important to remember that the EO gas is toxic and potentially explosive, and due to its toxic nature, do not use these instruments immediately. They should be used after a aeration period of minimum 72 hours. A microbiological control is mandatory, and EO gas sterility can be maintained if packed properly for 1 year in original packing. Indicators we use, just a few minutes, 1 minute more. It measures the efficacy of the sterilization procedure and helps to keep a record of the sterilization. So these indicators are important. There are different types. So we use different types of sterilizers. So thank you, everybody.